We're going to be looking specifically at systemic arterial blood pressure. We'll begin by defining blood pressure. Blood pressure is the force per unit area exerted on a vessel wall by the contained blood. It is measured in millimeters of mercury. Easily stated, it is the blood pushing up against the walls of the vessel. If you have more blood in the vessels, the blood pressure goes up, and the opposite is true. Less blood means the pressure will go down. There are two measurements in blood pressure. The systolic measurement, which is the pressure at the peak of ventricular contraction. What this means is that this is the pressure when the ventricles are ejecting the blood. So when you have the most blood in the vessel, this is systolic. Diastolic is the pressure when the ventricles are relaxing and no blood is being ejected from the heart. What do you think happens to the pressure in the vessel as you move further away from the heart? Remember, the heart is the pump, and blood is going to move along a pressure gradient from an area of high pressure to an area of low pressure. The highest pressure will be closest to the pump. As you move further away from the pump, the pressure drops, allowing the blood to move forward. The veins which empty the blood back into the heart, on the right side of the heart, the inferior and the superior vena cava, have a blood pressure that is close to 0 millimeters of mercury. Let's move on to pulse pressure. What is this? Pulse pressure is the difference between the systolic pressure and the diastolic pressure. If systolic pressure is 120 millimeters of mercury and diastolic pressure is 80 millimeters of mercury, the pulse pressure then will be 40 millimeters of mercury. The elasticity of a healthy artery will allow you to feel this as the pulse. Arterial sclerosis is also known as hardening or thickening of the arteries. So the arteries will become less elastic. This can occur as you grow older. When the arteries become less elastic, they will not expand to accommodate the blood during systole. Healthy arteries are very elastic near the heart, the pump, and they offer very little resistance. When blood is being ejected from the ventricles, these arteries attached to the heart will expand to accommodate the blood. During diastole, they will recoil when no new blood is being ejected into the arteries. If you have hardening of the arteries, they will not expand as easily since they are less elastic, and this will increase the pressure in the arteries, so systolic pressure will go up. If systolic pressure goes up, this is going to increase the work of the heart. I want you to try to figure out how this is related to afterload. Stop the video and try to answer this question. Recall that afterload influences stroke volume, and it is the pressure that the ventricles have to create in order to open up the semilunar valves. This is the pressure that has to be greater than the pressure in the arteries. So as the pressure in the arteries increases, afterload increases as well, and the workload of the heart goes up. The pulse that you measure is actually a pressure wave of blood. As I mentioned before, when blood is being ejected from the ventricles, the arteries attached to the heart expand to accommodate the blood. During diastole, those arteries recoil as the blood continues forward. That is your pulse. The areas where you can measure the pulse more easily are your pulse points or pressure points, and I have some of them illustrated here. Mean arterial pressure is what propels the blood through the vessel. It can be calculated using this equation. Diastole plus pulse pressure divided by 3. It will be around 90. So when I ask you what propels the blood through the vessel, I'll want you to tell me mean arterial pressure. Systole changes as you get further from the heart, the pump, but the mean arterial pressure is going to remain consistent and decrease in pressure. So let's look at this. This figure illustrates blood pressure in various vessels within the systemic circuit. Let's start with the aorta. Notice that there is a big difference here between systole or systolic pressure and diastolic pressure. And the mean pressure is not exactly in the middle or the average, but it is pretty close to it. Even though systolic and diastolic go up and down, so systolic being high and diastolic being the lower number, the mean arterial pressure, as you can see, remains consistent. The mean arterial pressure also decreases as you get further from the pump, and this is what allows the blood to move through your vessels. Notice by the time you get to the arterioles, there is very little difference between systolic and diastolic pressure. You are too far away from the pump. Also notice by the time that you get to the vena cava, the veins that empty into the right atrium, the pressure is about 0 millimeters of mercury.